We've all known people that have said that they have obsessive compulsive disorder, or OCD, about something. But what exactly is OCD? OCD is when you have patterns of unwanted thoughts and fears, that's the obsessive part, that lead you to do repetitive behaviors, that's the compulsive part, to deal with those thoughts. When these obsessions and compulsions negatively impact your everyday life and responsibilities like work or school or relationships, that's when it becomes a legit disorder. The good news is that you can learn how to manage the symptoms of OCD, know your triggers, develop techniques to cope, and live a happy and healthy life. Here are 5 common obsessions of obsessive compulsive disorder, or OCD. Number 1, fear of contamination, like your food touching germs or dirt. Number 2, doubting or having difficulty tolerating uncertainty, like if your schedule is thrown off, it really bothers you. Number 3, needing things orderly and symmetrical, like intense stress when objects aren't orderly or facing a certain direction. Number 4, aggressive or horrific thoughts about losing control and harming yourself or others, like yelling curse words or thoughts of crashing your car. And 5, avoidance of situations that can trigger obsessions, such as shaking hands. If this is you, you might have OCD. Do you have any of these common compulsions related to OCD? Are you washing and cleaning? For example, hand washing until your skin becomes raw. Do you check stuff like checking doors repeatedly to make sure that they're locked, or the stove to make sure that it's off? Are you super orderly, arranging your canned goods to face the same way? Do you follow a super strict routine, like silently repeating a prayer, word, or phrase constantly? Are you always demanding reassurance? Because this usually comes from an intense need to feel right and fearing that you're wrong. Even having one of these things could be a disorder if it negatively impacts your day-to-day life. Here are 4 different ways that you can actually break the OCD habit. Number 1 is distractions. You can try to break a thought cycle or a habit by calling someone, journaling, taking a walk, or engaging in a different task. Number 2 is to delay your habit. If you have a compulsion, try setting a timer to do it later. Little by little, try to keep delaying it until the urges decrease. Number 3, change certain aspects of your daily habits. By making small changes like the order of an action, how many times you repeat it, or how you do it, you can start to change the habits for the better. And 4, create consequences for your habit. When you find yourself repeating the same habit, perform a specific consequence, like putting money in a jar or texting someone. It doesn't have to be a big consequence either, just something that brings your attention to that specific habit. Now, I'm gonna be honest, OCD isn't something that you can cure all at once, and then it's just gone forever. But wait, you can totally learn how to control it. The goal is to bring awareness to your habits so that you can make a conscious decision to do something differently. Understanding what leads you to these actions and what triggers these habits is also essential in order to know how to change for the better. Cognitive behavioral therapy, or CBT, is a form of psychotherapy that helps you identify your thoughts and fears and restructure them to better reflect reality. Exposure and response prevention, or ERP, is a specific type of CBT that is super effective for people with OCD. ERP works by putting you in a specific situation that triggers your compulsions and then prevents you from doing what you would normally do. And I know that it sounds brutal, like handing someone an ice cream bar and saying that they can't eat it, but it's had amazing results for people with OCD. Academic support can also be super helpful, since OCD often gets in the way of everyday responsibilities like school. If you or someone you know is struggling with OCD and it's related to mental health challenges, visit sandstonecare.com or call the number linked up in the description box below. We'll get to know you and your specific situation and then connect you with the support that you need, even if it's not with us. Change is possible, and Sandstone Care is here to help.